paja ndiya munanganya mula majungo Mangochi paja ndakazi kwela kusegelea
Shatriki ndichokera klabu ya ng'ombe monga nkhati ndaumana ndi nkhanza yokuti ndagwidwa pasida pathupi ndipo ndi mwana ndenda pasida pathupi mapita school na stand date ndinayimira pamenepo pakadai panguyembekeza sekuti Yesu school kuti kubwera kwa JPAG kwachitisa kuti atisegula maso ife atsikana zokuti mnalikhani maganizo kuti anze tibwere Yesu school maso anjira yolowera kuti kambe schoolyo pakadai panguyembekeza kuti atipasa njira yokuti tingatobwera school
ngoba ndiuliso ndikenda kwambiri mbala za maphisi mbodi mukulabu mwatu munatsikana ngapo mina kuyembeza kuti mune bwera kambe na school mali oni milani ni akuneyo ndangotenga mimba musayembekezera mapano zolangana amene owandishidifal kuona kuti payatsikana amene omapuzanga kupanda ena kupeza komwe yophunzira za ulere nje kumbale kuti makolo ngochepekedwa anthu ambiri akuliya kwambi mwina taphunzira ntapanga form 1 for 4 kumaliza taphunzira maulere ndikuza kutani vindo zakhawo uzazidalira pandekha mumuna amene apasa mimba yasangamuganizire swera kumaso mbana kuti zolera anthu sotengapo mbali kwambiri mbali zolera pali anthu ambiri silimazindika zolera pano patukutengapo mbali kupanga tikukatenga njira yolera sizoona kuti zimene zonse kwa ife tukuyilandira bwino kwambiri kumaso zoyezesa magazi anthu somakhani chidwi kwambiri kuti kuyezesa magazi ndi kuti klabu yonse makhani chidwi kwambiri kuti kuyezesa magazi kumaso ntchitonso za umoyo kutengaponso mbali sizoona kuti wina aliyense panopa klabu ndi munthu wozindikira kwambiri komanso tikutengaponso mbali nakuti mathaso kuyendera anthu amene ali odwala klabu yathu timatengapo mbali timathakuona kuti basi mmene zikuonekeramu chiyendere kwa anthu amene kuona kuti akuswekera njira kuti angathola ndi athandiza kuchipatala timathaso kutero matsikana ambiri atengapo gawani kwati uyo kwathu Chikhwawa kwathu kwa Masache kali osalira kwambiri fala ambiri samapita kusukulu makolo amale so basi mwana kasena kuphunzira kumaphunziro wa mwamuna ndipo mwaziona ngati pale mimi mapumbe mina kubwera apa kholo ina lense panopa yakhandiki kwambiri mwana wankazi lofunikira kwambiri kuti aphunzire ndetu kuthokoza kwambiri kubwera kwa JPAG soza kuti atsikana ambiri makolo so ambiri tiozindikira kwambiri zimene kuti anathu abwire usukulu
tsina langa ndi Gloria Stonadi tikuthokoza kwambiri kubwera kwa JPAG chaka chimene kunabwera JPAG tinakhala tsikana ozindikira komanso omasuka pagulu kubwera kwa JPAG uzatiphunzitsa ife kubwerera school nali atsikana ena amene anatenga mimba mosayembekezera atsikana amenewo pakana anakhala ndithu JPAG itabwera atsikana atamva uthenga umenewo ndi zomwe amafotokoza a JPAG atsikana ena anabwerera school kapanga maphunziro awo koma ena panabwera amapanga za odera linyi ena adapindulapo ena anapanga za bakery ena anapanga za saluni ndeno kubwera kwa JPAG ife zatiphunzitsa kuti atsikana amene ali obereka kuti akuyene kubwerera so sukulu kulibe kuti munthu ndi wankulu kapena kuti wabereka kale ndiye JPAG idatiphunzitsa kuti kuli ufulu munthu oti amene wabereka kale akuyene kupita sukulu JPAG yatiphunzitsa zimenezi
ndinebeimisindi ndalega mukarabu kubwera kwa JPAG kumbali yophunzitsidwa kuntchito za manja yatithandiza kwambiri ife ndipo yamba tinali atsikana oti timaswali ochita mamidzi mathu timangokhala kulephera kupanga kina kali konse koma amene taphunzitsidwa ntchito za manja chonchi pena munthu ukasoka ndalama ija mathandiza naye pakomoka kugula chakudya kaiya ulini bala wako kuti mina kupita ku sukulu mina yesu naye chisamula chikuntani chikumusiwa mathu akumutani kupasa kwa drama jabuta zikarani azikalipira uskulu komanso timataso kuthandiza zathu mwe amene ali mkati mwa klabu wathu mwe maphunzisana ntchito za manja zikati zimene ine naphuza za lera lino ne balena naphuza za bekale ena naphuza za saluni
ine tinanga ndi aida malimau ine kwanga ndikuthokoza kwa kubwera kwa JPAG kubwera klabu wathu nayo kumbo kwambiri ndipo kumasuka monga ineyo nalipo pabanja ndakhalapo ndithu kwa zaka zokwanira ndabeka nanga folo chifukwa chakubwera bungwe imeneyi kunani masuka kuti ndibwereso ku sukulu ndinayambiraso stand date kenako ndakhoza ndapita ku Fatima Girls secondary school panopa ndilembeza kukafika form 2 temu kubwera ikangotsedula ndikamba form 2 ndiye ine ndili omasuka kwambiri kuti ngati atsikana zanga alipo amene akufunisisa kupita ku sukulu asasire panjira yayi arenge chitsanzo ine ndemwe ndine mkulu kwambiri koma ndinabwera mprimary anthu kumanditana dzina anga aida komabe sinadandaule sinawilingule podziwa kuti ndinali ndi chidwi ndi mmene anaphunzitsira a JPAG komanso ndi mmene ndimaonera atsikana zanga kuti ndinaphunzira nawo ndili mwana ayamba zintchito ena ndi manesingi ena ndi apolisi ndi ndinasirira kwambiri kuti kodi inenso ndikafike pamene paja ndipange bwanji ndiye ndi bungwe idabwera linandipangisa chikhumbokhumbo yanga kumasuka kuti nanenso ndifuna ndizakhale ndani ndizakhale munthu oziyimirira pandekha kugwira khasu ndithu ndi mamuna kupita kumunda ndachiona kuti ndi chinthu chopanda ntchito ndithu choti mamuna amatha kukunamiza kuti ndikukwatira zikapitiriza sukulu kubanja konko koma kumakhala kutani kumakhala kutinamiza monga ine nasiya sukulu chifukwa chonamizidwa iyayi ukakwatiridwa konko ukapitiriza sukulu kuti kubanja konko koma sizinatheke zimakhala zinthu zabweza ungofuna kuti tifisa kuti bweza mbuyo maganizo athu ndi atsikana ambiri ngakhale takula kale ngati ine ambiri mukundidziwa koma sindinachite chinthu cha manyazi chifukwa cha bungwe imeneyi inandigwira pamkono ndikupita kuti ku sukulu ngakhale kuti zinachitika zinthu zovuta zosiyanasiyana koma mpaka pano ndikulimbikirabe sukulu ndifuna ndizakhale nesi chifukwa cha bungwe imeneyi kubwera kwaje chandilimbikitsa kwambiri kuti ine ndibwere kuti ku sukulu ndiye ndikuti zikomo
tsikana tinali womangika poyankhula pa gulu ndi anzathu komanso tinali womangika pofuna kuphunzitsana monga zaezi zakulera choncho kubwera kwa bungwe limene lili kuthokoza ndipo thokoza tifuna kuti bungwe limene lipitire mpaka na pasogolo musakisire panjira ndipo ine ndi omasukaso kuti myezi kubwera yeti ndikampeso sukulu fakeni nazayamba kwa mwezi kumanina ile phesi ndiye ndimafuna kuti ntakayambiraso ndiye bungwe limene lili hayi lipitire pasogolo ndithu
munthu mmodzi amene ndilinso nawo mbali yotengedwa luso la manja lomwe JPAG yatithandiza kwambiri oti panopo ndipokwathu masowekera zambiri oti ndikasokasoka ndalama ngajaliwati akatenga munakula chokudya kula zovala ndiye panopo antithandiza kwambiri panopo sikusowa china
tidaphunzira ntchito yoti chiyambireni sitidayikuidziwa ndipo pochoka kumene kwadati pasasitata pake ndi zida zoti tidayambire chani tidatsekulire show tidabwera tsopano tidagwira ndithu ntchito yoti anthu atsimikire zoti kumene kuti magwira ntchito iti imene pano kuthandizika kwambiri makolangaso makhala ndidalira chifukwa choti ndikamanga munthu ndalama imene kaya pafumopo pali kusuta china chake ndimathautani kuthandizika nayo
kwambiri koso kwandichulwa moyo wanga sinali kudziwa china chilichonse anabwera anthu zatilembera kutipanga ma interview kena kundikhoza kupita kuchiratu kuphunzira kumene kutakhalako miyezi 4 naphunzira ujeni electrician ndife aujeni a electrician pano timapanga wiring ndiye panopa ndayamba kudya ndalama kuchokera muti mu JPAG panopa ndikuithokoza kwambiri anzanga ndimalimbikisa kuti musasire panjira tiye ntipirikize kusogoloko tikapanga ndalama zambiri ndithabwera ku sukulu mamuna adanisiya kalekale ndabereka naye ana ndiye panopa sinimaganiziranso kuti kuli ndani
ine ndine Natoni wakuti mvale ine ndikuthokoza bungwe imeneyi ya JPAG atsikana ambiri kale adali wopulikira sadali ozindikira koma panopa azindikira zambiri ndithu pano atsikana akulera ndipo akubwereranso kumaphunziro chifukwa cha maphunziro imene cha JPAG pamene anabwera ndiye tikuthokoza kwambiri kuti bungwe imene ipitirize ndithu kuti atsikana ambiri azindikire ndithu
kuchokera kwa chipatala pani
kuyetsesa magazi komanso ndi njira zakulera zimene tikulandira panopo.
Agile na marirengera azachipatala amabweresa njira zolera kuti ninyamuke ndipite kuchipatala ndimakhala omangika nanga sindipa khomo papongoza athu samalola kutenga kalera mabwera kwa JPAG kwandipangisa zoti ineyo ndizilinga kalera kumagizana munjira za amunanga ndi ineyo koma amunanga amandivomera kutenga kalera mpaka nakati ndi mwana mmodzi.
Ifewo mabwana atamba kutumuna kwa mbili Koma kunena kwa Chikhwawa makolo ambiri asipita kuti bakati pa mwana wakazi koma bakachita mafuko kena mai amene amatakuta lisikosi amene kumva mafuko masanga kumadana amakhala amene mwana wa mwana amakaja akachita masaka ndemwe amene akutaka mafuko hana kuweza kuongoza kikaza cha kusangala ifeyo tikatibulira kuti machilubamo unogomera fulokoza kuyamba kwatu kwa kuti ila bila kuti maluba ngale kuti ana mena ne taima kuzo kucheka mabweni baloba ninao kufa kyote kusalingana soje za kuti kuinda mano mwina mwaji kumene tukolanda wa mamuno ya kusabe yafu kuna mwaji imelero kama challenge danda la kwambiri sio kuna kama sisi ni ana ameenda kutoa kupita kwa Masache about 20 kilometers ndiye matimu mwana kwetu 40 kilometers wamene bobo ndiye how ya mfula ngati mfula jainga kwe ngati twins ndio ana jamaa kukhalira kutoka amena makolo mimi mngoni na shule kwenda kurogo akutoka mbali kwa
Ndine bungwe mene ndikuitokoza kuti neni kundele mene kumasowa noko ndikamekhala mudzi ndimata kumamangazi zanga kumapeza ndalama ya sopo kumwe kusana nasiya sikulu simachita chile chonse nabe chile chonse koma nditokoza bungwe mene akuti ndipasa chochita panopa ndikuganiza kuti mwananga pansi mwingine kapena amba kuyenda ndikaseka saluni yangu
ndebungu imene yandipindulira kwambiri moti kaona kuti mathandizika kwambiri panopanda munthu kuti sindazoyina chilichonse yabungu imene yandipindulira kwambiri kukhala mkumusowena pake ndali munthu wamantha kwambiri koma panopanda kutha kufotokoza pachina yesu pakugatanimayo ndikuthoza bungu imene kuti isasire kwampa ipitire sogolo kuti anzathu ena sadapite kusemina amene watani atenge suluso wamanje imene ipitire kusogolo kuthokoza kwambiri
Okay, yesterday we had a very fruitful visit to the field, and today we agreed earlier on during planning that we would have met before the field, but we said maybe we should go to the field first and then come back and then listen from the district in terms of progress. So I don't know how we want to do it, but we wanted to hear from you first to say how is the project progressing and what have been the strength and maybe the challenges. From there we can input using the information we got from the field. As also outsiders, maybe we can also look at the strengths and the weaknesses, and then not really weaknesses but challenges, and then we see how we can move forward. So we throw it back to you to brief us on how the project is progressing. And then from there, we'll add from what we saw from the field to say, this is what we observed and maybe this is what maybe needs improvement or this one is a strength. So I give it back. I don't know whether it's you, madam, or the team leader, yesterday's team leader.
As a district, in terms of progress, I can say that this time around we have managed to at least cover some activities which were planned, and also we have added some new clubs, girls only clubs in the other areas. And in addition to that, these clubs, they are also competing on their own, meaning that they have the willpower, they know what they are doing. So on their own, they are also at least participating in several activities. For instance, they can have a competition which is organized on their own. So too, we have also increased the knowledge in the area, in that some of the areas which were not reached last time, we have also managed to reach them this time. For instance, UNECO had organized several open days in the area. Those several open days, we managed to reach some other hard areas which were not reached during the first period. And we also we managed to at least have some talks with these clubs to learn what is it that they are doing, the challenges that they are facing, and even discussing with them on what is it that they think should be the way forward on the challenges that they are experiencing, and even the activities which they want to embark on during the next step.
They're able to distribute some materials to the youth class. Reference materials, we got uniforms and some reference materials. For them to use when they are discussing, also distributed boards to guide them to take part in sports.
This time around, we have managed to distribute some posters,
and some
leaflets,
yeah.
to
For them
assist
to
them.
use us for their discussions when they meet as youth clubs.
Met, I think, two times, if not 3 times, to discuss on the program activities.
The project has 5 strategic areas. So, like strategic area 1 is on education. Perhaps we got some, because what I hear from him is to do with his area mostly, but the special strategic area where you increase girls' participation in community development, youth clubs and the like. But I have something, any progress on the issue of scholarships, education, and CVSU, and you hear that as a district you're supposed to establish a one-stop center. I don't know.
But they managed to pay up all the balances that they had in the primary schools. They distributed the uniforms to almost all. I think it's only 3 schools that are needing.
How many are getting the scholarships?
As in the number of
the district,
the number of beneficiaries or the number of schools.
150.
It's one.
Is it 150?
Yes.
Yeah.
It was in the first.
It was 120.
2011, 2012. It was 100. So this 2012, 2013, they increased it to 150.
Yeah.
And they said that there were some more that were meaning that they could distribute to some more. They could add some more beneficiaries.
The same education side. I think last week we had a monitoring visit to all the schools in the area. Yeah, we managed to discuss with the pupils themselves as well as the head and the coordinator.
Even at the hospital, we don't really have a specific room for the youth-friendly services. The same with Katuli, I think that one is not really made for the youth-friendly. It's also used for some. I think it's for
the waiting room for the antenatal and I think ART clinic.
Because I went to Zonga General Hospital and we really found a room that is specifically for youth-friendly services, and there were children and young people playing there. There were games and everything there. Unfortunately, we don't really have that here. But I think it would have been an opportunity with this project to establish at least 1 or 2 of them.
Each facility is supposed to look at which strategy applies better for their facility. Because for youth-friendly services, right now we're talking a lot about integration. We don't really want to separate the things. But we can have a youth corner, but it's up to that facility to make a decision looking at their situation. Because for youth-friendly services to be offered, offering it in one room is just one strategy. They can create special time for young people, so that time, that specific period, they said this time maybe from 1 o'clock to 3 o'clock is really meant for young people. And sensitize young people to say, at this facility, if it's not an emergency, we'll be meeting you from this place, this time to this time. So each facility is supposed to look at which strategy works better.
You mentioned something about the one-stop center. At the hospital, we're using the STI room again. Okay. When it comes to child, you say you have got a client. Somebody want to be treated for STIs. They say, can you stop first or finish with this one?
And yesterday I had a feeling that we're not doing enough in terms of reprimanding the perpetrators of GBV. That's a personal feeling, don't put it on record. Because I saw one who disappeared, the other one was burned out, the other one served for, is it 2 years, and they came out and saying, are we really doing enough in terms of
96 months.
Yeah, 96 months. So I had that feeling, don't you put it on the record, that these people that are like perpetrating GBV, I think. But I know that maybe it's our problems with our laws. Because if it says 2 years, what can the magistrate do?
No, judiciary goes for fair trial. So they don't go for the maximum, but for something that is fair. Yeah.
On strategic area 3, GBV, I think you might be aware that towards the month end of June, we, in partnership with my district stakeholders, we conducted my campaign. We had my community awareness. I think we go to Mangochi, Katuli. Obviously, it cannot cater the whole of Katuli, so probably it might be reflected somewhere. And as well, taking this opportunity for we have been talking to my partners with direction from the DYO, which is even a police and trying to sensitize my adolescents. I think the issue which is there, and it has been coming out in our meetings, is that target yard, the target, obviously in a data which we are getting might have from people who are out of the 10 to 19 category. And I know we are heading towards the end of the project, but we still have little time to actually come back on track and hammer down on the 10 to 19 category. I think it's possible, even in Kanisa GBV, even in Kanisa Sub-Chipata, and even my CBDA, I mean, unable to the Ashkuri on bill. And I also felt, personal, if I'm an adolescent, to access those services, which might be contributing to the figures which they are having. And even Momana Biankira, it was like a guessing. We are 35, we are 26, something.
For CBDs, they have a specific age. Actually, I had that feeling, but I think I need to find out for a reproductive health unit. Because there are certain programs, age is in the guidelines for certain reasons. So I need to find out. But I felt that I don't think an adolescent can actually go. That's why I was asking to say counseling, like when you look at CBD, counseling an adolescent of 30 years.
Yeah, unfortunately, when they were choosing the CBDs, we had some challenges because they did put a specific qualification for them. They were looking for those who had JC, so the whole country only found that the rest were so they didn't have
GBV. When I listened to the report, I think he said the cases were referred to the police, they were referred to the courts. Now I was thinking in terms of the emphasis on linkages. Now thinking in relation to the health sector contribution. I know that those cases are also supposed to receive some services from the health facilities, like the post-exposure prophylaxis and the like. So maybe as we compile our reports on the victims of GBV, especially the rape cases, let's also indicate whether they received those services from the health facilities.
Reporting the different types of violence, being it physical, sexual, neglect, they are not well coded and they are not part of the HMIS.
hospital will just report them as a maybe trauma, or something like that. It's something that we need to think about. Maybe we should consult with NCB, clinical services. They are thinking of doing that, but as an intervention, we can ask them to whatever guidelines they have developed, then we can support Katuli Health Center so that they can start the recommended case definitions for the different types of violence.
The guidelines for sexual assault and rape for Ministry they are there. Yes. The guidelines are there. Right now, Ministry of Health is just trying to review the guidelines. Yeah. In terms of indicators, we actually had a gender assessment with the consultants, with the Gateway project. We have noted that there is no indicator at national level, like in the health swap, there is no indicator of GPV. So the director of swap decided that they should include one composite indicator in there to enable health workers to track these things. So I'm thinking that maybe it will be addressed. But in terms of guidelines, the guidelines are there. It showed like there was the numbers accessing the services was like very low. So when we looked at the tool that we use at the youth-friendly services, it was noted like we are capturing new visits and revisits. And when you have like new visits and revisits, not necessarily capturing a client, it is difficult for us to capture new clients for if they are accessing several services. For example, they come like a new client, but they are accessing several services. It was difficult to isolate from the tool. You say this one has gotten this, from here has gotten this, and even on the revisits, it was just revisiting, but you don't know they are revisiting for what. So we said maybe we have data that has been missed. So we are requesting like the DC say, for example, in the hospital, I know we have several registers. If you go to maternity, you find the ages are put in there. So maybe when we are reporting, we can go beyond just that data collection too in the youth-friendly site. We can check in other areas to say how many young people access to the services. For example, in maternity, you can get data. When you have where they're doing like MVA, where they do post-abortion care, you can get data on young people. STIs, HIV, you can get data for young people. So as a district, when you are reporting everything about young people. Of course, you might say, no, but the project doesn't provide money for this. But when you conduct open days, people go to the hospital for various services. You cannot actually say this is attributed to this. At the end of the day, the sensitizations YONECO is making, we don't know who else is listed by that information. So as a district, we should be reporting data because we felt, I think the numbers were too low compared to the number of advocacy meetings done, the sensitization and the support provided. But we found that the tool is a bit defective. And then we are saying now we are moving towards the end of the project. How are we going to report? The project doesn't have a specific tool to collect that data. And it was agreed and told at the beginning that they use the existing tools to collect data. So if we don't have a specific tool for the project, how are we going to report?
But I suppose
let's say at Katuli, if
they were supposed to use that the reporting forms that they use at the district hospital at Katuli.
Yes, they have them. That's what I'm saying. What I'm saying is, for example, yesterday when we went to this room for youth-friendly services. You will find maybe a form, even when you go to the hospital, where they offer youth-friendly services, they have a data collection tool. But that data collection tool will not give you data for young people from other areas, like HIV testing, for example. You may not get that data. You may only get data for young person who came for youth-friendly services and he wants HIV testing. But you have other areas, PMTCT, for example. They also, young people also going for plain PCD, those that are married. But that data is not. So I was saying for him it will be easy because you can just go around and say maternity, how many young people accessed delivered in this month or this quarter. You will just count. You go to PMTCD, how many young people accessed PMTCD services. You just count how many young people have been tested. You just count. So as a district, it's like we are reporting less.
Should they report for the district or for Katuli?
Even for Katuli, for this one, the data that we have is just for that form. Don't go up to checking in the register for maternity.
Actually, when they want to report, they check all these figures, like the those who have delivered in the neighborhood. They also included them to the reporting to of different services. But there's this challenge of maybe double counting, because one could come for maybe condoms, and the same client has also accessed maybe anti or HTC. So you see that the same client will be counted too. So it's again a challenge. And the other thing is when you look at the project document on strategic area 2 output, and when you take the reporting tool of different services, you'll find that for us to report on the output of the project document on strategic area 2, and with the reporting form of different services, it's very difficult for us to report on that.
I think what happened anyway is maybe now what under the field. What we would have done initially was maybe to develop a specific tool for the project, which is not there. So when we are reporting, even if you look at the indicators, like for strategic area 2, it's number of young people reached with adolescent information, adolescent success in contraceptives, those exposed to stop early marriage campaigns, girls in youth clubs, health personnel trained in youth friendly. How are you going to collect that data? Because at the end of the project, we must report as they are. So the suggestion I was making is that we know that Katuli Health Center, young people might come for different services. For example, they might come for HIV testing, antenatal, just maybe peer education, maybe recreation. Somebody needs to capture that data. And when you look at the tool for youth friendly, yes it does, but we also have other tools that we had put in place. So which one is more robust that we can get our data from? Maybe that's an issue that needs to be sorted. Because I see that at the end of the project we will have challenges in terms of reporting. But I know that as a district, he has data of how many young people access to what at some point. Even for quota, he can actually isolate that from the tools that were laid down by maybe the ministry.
But on the issue of the consultant, I wanted to let the DYO know that that activity was done with the DYO app. Of course, she was not in the office. We had her deputy, so we did that activity with the deputy DYO, and after we finished the activity, the report was shared. I think the deputy DYO is having that report. Of course, they said after they finalized, like when they go to Chikhwawa and Mangochi, they will also share the final report.
And some suggestions were made. In fact, the consultant recommended that maybe the M&E team could come and do data audit. Actually, they were saying they can come and check what type of data is being collected on young people. And maybe from there now we can see how we move forward. But he also said that data audit is an exercise that can take many months. So we are saying now the project is It's supposed to finish in October.
Yeah, I think as it is being said, it seems there are quite a number of some data gaps from the reports that are generated from the districts and transmitted to the national level. And as it has been said, in the initial discussions, we're talking about conducting a data audit, but that may take a long time. So as an alternative, possibly what might be done is to choose maybe some random months and collect the data and use a model to estimate, to say, okay, based on this information, maybe we can estimate, for example, for youth-friendly health services, we can estimate that so many girls access the services. But still, the exercise will involve going into the various records. I think Mr. Ashiteje, you may remember that when we were looking at the service utilization forms, we saw that, for example, for some services like PMTCT, there were so many zeros. But when you looked at antenatal care, there were so many, so there's quite a number of young people. So the question was, were all of these HIV negative? Not even a single one HIV positive. Not even a single one went through the PMTCT. So we felt that possibly when compiling the reports, some registers might have been missed. So that's what we want to do, to get the data from all the data sources and estimate. But to do for each month, it may not be feasible.
You already have the data that has been collected, the forms that have been collected, and what you do is a retrospective check of the previous months. You decide whether you want to do 6 months. You see how the data has been collected, and then you make suggestions for improvement.
Yeah, the thing is, we looked at data from January 2011 to March 2013, and that's quite a long period. And for the youth-friendly health services, there are more than 8 services, yeah? Which means maybe 7 plus registers. And the team has to go to a health facility to go into all those registers, extract the information, because in the register I just write maybe Susan Kambari, maybe age 17 and the like. The next one will be Rose in Kowe, maybe age 30. So you have to check in the register page by page, extract the adolescent data. So it's quite an exercise. When we were doing the data compilation exercise, there was also, we also had a feeling that possibly as implementing partners, we may be implementing the same activities, targeting the same girls. I mean, possible overlap. So that's something that we may also need to look into. For example, if I look at our strategic area, we have YONECO, we have DHO, we have MAGA. I know DHO, they conduct the life skills training. Maybe here it's different, but in Chikhwawa, I know that they also include the in-school adolescent girls in the life skills training. And I'm sure MAGA also do something similar. They also target the same in-school girls. And YONECO, I'm not very conversant with it. And the DHO also targets out of school, the same youth clubs. So maybe we may need to sit down and look at what is being done by each implementing partner and see how we can complement each other.
Yeah, actually what Susan is saying, I already saw when I got the reports. I got reports from YONECO, got reports from Ministry of Youth Matter, and then I told Matter, why are you not working in collaboration with YONECO? I said, no, Ministry of Youth, actually, why are you not collaborating with MAGA? Because you seem to be doing the same things. So indeed, I think there are some overlaps that are there, although we may not be doing the same things. But in terms of collaborating to see that we are not duplicating efforts, I think that needs to be done.
The completion issue, it's really quite impressive. However, I don't know
the documentation that is done when we have our district coordination meetings. For example, going back to the issue of possible overlap of activities, do we keep a record of, assuming you meet on a quarterly basis, do you keep a record of the activities that have been implemented by each partner and the activities that are planned maybe for the next quarter by each partner? Because in that way, I think it would be easier to see if there are any overlaps. If, for example, DHO is planning to conduct life skills training for in-school girls, and MAGA is also planning the same, then maybe you can agree to say, okay, maybe MAGA you can concentrate on these schools, and the DHO will concentrate on these schools. The same with the other school, Adolescent Girls, something like that. And the planned activity as well, because during the data compilation exercise, we got a feeling that in some cases, partners within the same strategic areas, it can happen that one partner is implementing an activity which the other partners are not aware of, which is not supposed to also be the case. Yeah, I think it is true. And I also, you've just reminded me that for us, UNFPA, we also support Mangochi district, some other youth activities. Those activities are supposed to strengthen all youth activities in the district. But it's like, if you see that, let's say Katuli Health Center, if there are no service providers, it means even when young people go there, they will not find a service. So it's up to the youth-friendly coordinator to say, I've been given money to train youth-friendly service providers. At all costs, I should include those from Katuli, so that you strengthen that area, so that when young people go, they don't come back without a service. The same applies to peer education. Peer educators can strengthen the youth-friendly side. When you are training from others, consider that Katuli to say, how can we strengthen it? What is it that is missing? So that the Katuli Health Center is complete. Plus, then we scale up in other health facilities. Let's not look at them as two separate projects, but they are aimed at strengthening youth activities in the district. And one time I was just asking, I think he was not there, I came to meet the metro, last time I came. I was asking, he said, what have you done? He said, we've trained peer educators. I said, was the DYO aware of this? Somebody, you are not there, but she said no. I said, but do you have expertise to train peer educators? Or the DYO has. You have expertise to train youth-friendly health providers, but the DYO can train peer educators. Because they have peer education manuals for in and out of school. But because you are not there, she could not answer properly. But I saw that if something is out of your expertise, then let the other person do it better. Because the DYO cannot train health workers in youth-friendly services, but she can train out of school young people in life skills and peer education. That's just my comment. Of course, when you are in school now, when I'm on holiday, I'm out of school.
Yeah, you're out of school.
On peer education, we need to strengthen peer education. We have now managed to develop materials which have key messages. By now, we should have key messages for all the strategic areas. We just completed the development ISM materials with UNICEF, which is now going to have a complete package of key messages for the project. But now, translating that into practice, there's need to use all the tactics that we need to use. So one of them is strengthening peer education. And we need to discuss amongst ourselves as agencies, and then we will be this to think of how we can sort of use these key messages to transmit them to the population.
Yes, as you have said, as a district, I think we have the planned activities which at the same time we follow them accordingly. But however, there are other areas whereby we face some challenges. I remember last week there were some open days which were conducted by UNECO, while at the same time we were also conducting some monitoring issues with the DYO. Unfortunately, we just bumped each other at one point, whereby we were not aware as to where our friends are also conducting another activity in the same area. So it was a hassle. But all the same, we discussed with the coordinator at that time that we need to pass through the district coordinator so that at least we should be able to organize the activities.
Whether we discuss the activity that is done in the information, we do that. Unfortunately, we don't go into details. We just mention what we have done and what we are expecting to do. Every we do it in monthly nation meetings. Unfortunately, I've been requesting to get the reports so that I can compile them as one district report, and it's really you have to come in. That's the challenge. The other thing is there are some strategic areas, some implement partners also report on the activities they plan to do. Unfortunately, this year most of them didn't get funding, especially like the community development, social affairs. So because of that, they did not conduct any activities, they did not implement any activities. And now there was a question that was raised on what can be done in terms of the funding congregations. Because the women development wouldn't get the funding because the WASH project, exactly, the WASH project has a balance.
That's what we were told.
Not necessarily the community development, but the Mangochi district through the WASH project has some balance in the system, so they cannot get the funding. But for them, they do not have any problem with the reputation because they pay them. So we were wondering what can be done on that congregation.
Yes. For us, I think I was talking to us like last night that we found that we didn't get good information to do stories from the newspaper. Basically, that's what we're here for, write stories and get pictures. So from the last time, I think we've seen quite an improvement. Jim mentioned about the coordination, and I'm thinking that because we came together as a team, also a class, and we visited a number of areas and got enough stories. I was telling my children, talking about yesterday, that it's like we have information overload. We have like a lot of stories, and I think that's a good thing. We'll be able to, choose the best stories and best pictures. And the good thing is we also talk to beneficiaries, which will make very good human interest stories. And that's what exactly we want, not to get stories from a boardroom, but from the beneficiaries themselves.
People don't have one. Yes, Rose.
Yeah, I remember some time back I attended one of the meetings for JPAG, and there was a mention of billboards, which Pilani is working on. But then we were about to come to the districts and to meet with the team to decide on where to put the billboards when they are made. So I don't know if as a district you've met or you have discussed this before, so that the moment the billboards are ready, then we know exactly where to place them.
I know that has been in practice, like where a health facility is providing friendly services, you put something. It's not called a billboard, I don't know what it is called. Signpost that says this is health facility, yes, something like that. I haven't seen one at Katuli.
It means it doesn't qualify.
So
I can strongly answer that one.
Okay.
Because you only put a poster that this facility is youth friendly if it's accredited. Yes. Ask you. Am I lying?
No.
Ministry RISU come to Katuli, so they have to assess in terms of youth friendly standards. If that facility meets the standards, they will put in their accredited. Once they are accredited, they will write in full board to say this facility is youth friendly. Today we know you are committed people, you have a lot of things to do, but you made yourselves available, and I was very much impressed with the arrangement that we were able to have a view of all the strategic areas, to have a feel of all of them, and especially meeting the beneficiaries. Without you, then there will be no project. So we are very thankful. United we stand, divided we fall.
Ine dzina langa ndine Aida Malimau, ndachokera mudzi mwa Konzere, ndikubwera kwa JPAG. Ndikukhala ku nyumba, ndinakwatidwapo ndi stand date, ndinasiya school, mamuna anandinamiza kuti akandikwatira ndizabwereranso ku school. Koma ayi ndithu zonsezi mamuna nditamufunsa kuti kodi bambo mwandikwatira ndibwerere ku school, ati ayi imene inali kampeni chabe, ndimafuna ndikutani ndikukwatire. Ku school usipitabe iwe ungadandaula school mesa banja ndiye ili yabwino. Ine kuyang'anisisa mbanja mujapeza mavuto osiyana-siyana, mamuna kuthawa ukagona